On July 30th, 2025, nurses across Nigeria's public hospitals embarked on a 7-day nationwide warning strike, demanding better pay, working conditions, and mass recruitment. The union has cautioned that the action could escalate into an indefinite strike, the first by nurses in more than 20 years, if their demands remain unmet. Why nurses took a stand. The National Association of Nigerian Nurses and Midwives, NANNM-FHI, issued a 15-day ultimatum on July 14th, urging the federal government to address long-standing concerns, especially poor welfare packages, unpaid allowances, and unsafe work conditions. With no meaningful government response, the ultimatum expired, forcing the union to strike. Union leaders demanded urgent implementation of allowances, including correct shift and call duty allowances, current rates far below circular stipulation, hazard pay and uniform allowances, retirement scheme reforms, and policy inclusion for nurses in Federal Ministry of Health leadership. Mass hiring to fill critical staffing shortages. Strike details and health system impact. Starting at 0:01 on July 30th, the strike mandated a total work stoppage across all federal health institutions, teaching hospitals, federal medical centers, specialized units, general hospitals, and primary care centers in all 36 states and the FCD. No skeletal services were permitted, raising concerns over critical units like emergency, ICU, maternity, and surgical wards. The Oyo State chapter swiftly joined, underlining the nationwide solidarity with union demands. Collapse despite government engagement. A government delegation led by Labor Minister Mohammed Dinjayati held negotiations with union representatives on Tuesday, July 29th, but the meeting ended in stalemate, especially due to the absence of Health Minister Ali Pate, which the union viewed as undermining any possibility of progress. Union leaders such as Christiana Adeboboy, Lagos head, and Toba Ajamosu, state secretary, expressed desperation, warning that without substantial concessions, the warning strike may extend beyond its expiration. Workforce in crisis. The strike highlights deeper systemic issues. Over 42,000 Nigerian nurses have left for jobs abroad in the past 3 years, crippling domestic healthcare. Nurses make up nearly 60% of the healthcare workforce in Nigeria. Their absence threatens emergency and maternal care services nationwide. Critics warn that Nigeria risks labor shortages and declining healthcare quality unless welfare and working conditions improve. Stakes and what lies ahead. 1. Union pressure escalates. Should the government fail to act by August 5th, NANNM has pledged to issue a follow-on ultimatum and potentially launch an indefinite strike, which could paralyze federal healthcare services. 2. Healthcare access threatened. With no services in critical wards, patients face delays or referrals, even those in dire need. Analysts warn the strike could lead to preventable deaths. 3. Public pressure builds. Civil society groups and healthcare stakeholders are urging the government to broker meaningful dialogue and implement reforms, not just for nurses, but to stabilize Nigeria's healthcare system. Final thoughts. This warning strike marks a watershed moment in Nigeria's health sector. Nurses, long the backbone of public health care, are demanding dignity, recognition, and safe working conditions. As strikes by doctors and other healthcare workers continue concurrently, the government's ability to negotiate substance, not just optics, may influence public trust and service delivery for months to come. Nigeria now watches whether the federal leadership can avert a healthcare crisis before it unfolds. Thanks for watching. If you enjoyed this update and want to stay informed with fast, reliable news, don't forget to subscribe to Newsflash 360. Hit the notification bell so you never miss a story. Your next headline is just seconds away.